Hey guys, Mike here from Well and Able Integrated Health, doing another walk and talk here, solved by walking. I think this is 4. It's been a while since I've been out. I've been a bit busy, back to work and family stuff and getting everyone going. So, pretty cold out, so I'm gonna try to be quick here. My hand's a bit cold. We're expecting snow. I heard someone say they wanted to talk more about medication and how that affects my treatment plan. And I think it plays a big role because I can learn a lot by what meds someone takes. So I'll often ask people, what meds have you been prescribed? And are there any over-the-counter meds you're taking? So someone might say, oh yeah, I'm taking Tylenol. Okay, does that help? Do you find any difference with that? And that tells me something. That tells me, okay, it's probably more like a chronic pain, like a proteoglycan, some kind of like in the spinal cord kind of mediated stuff because of how Tylenol works. Whereas if they say, yeah, I take an ibuprofen or I take an anti-inflammatory, an NSAID, then I know, okay, and that works, okay, then we're looking at probably some inflammation-mediated pain, and we can deal with it that way, probably more peripheral-driven. Or they might be say, yeah, I'm on gabapentin or pre-gabapentin, and that tells me something else. That tells me, okay, this is what the doctor thinks is going on. They think something like more centralized pain, more along the nerve itself pain. So nerve spinal cord issues, because gabapentin's role is to change the signaling within the nerve. Press a lot here. Okay. Or they might be on maybe some SSRIs, which are often helpful for pain, a low dose SSRI at like 10% of like a dose for mood. And they'll often be for more centralized pain as well. It's kind of a, let's see if this works kind of approach. Or they might be on like a Valium type drug, like that kind of class of drugs, which would also be centralized. But also or they're on opiates, right? And we can also know if they stop taking those drugs, things can go wrong too. If you try to go cold turkey and you've been taking opiates for a few months, when you take the opiate drugs, like a Tylenol 3, OxyContin, things like that, after a while your body stops making its own mu-opioid within itself, and it stops making their own opioid receptors. So you take the drug and then you stop cold turkey. Now you've got no opioid receptors, you're not making opioids, and things are gonna hurt because you're not able to kind of slow down the signal in the brain and spinal cord. And so I can't really tell people what drugs to take or when to take them. I don't really give advice. People ask me sometimes, what should they do? And I'll tell them, go talk to your pharmacist, go talk to your doctor. I can't prescribe. But them telling me what's going on helps me focus on what I can do for them. So if they're on an Advil, I know I can probably help them out, especially if it's more chronic. If they say rolled their ankle, it's swollen and bruised, and they're taking an Advil, I probably need to back off of it with my treatments. And a little ditch here. If they're on Advil and it's been like a month or more, then I'm like, okay, we can probably do something about this. If it's like a Tylenol really helps, then yeah, there's probably some stuff I can do with some targeting different physiologies. So that's kind of how I look at medicine here. Just as maybe a guide or a clue to kind of point me in the right direction. Because we don't really treat people, we don't treat their anatomy, we treat more what's going on inside them, their physiology. We kind of help be a catalyst to change their physiology. Especially if their pain changes within the hour, we know that pain, we didn't change any anatomy. We can't change things that quickly in our body. We don't heal a wound within an hour. And so it has to be physiological changes. All right, okay. I'm gonna sign out here. Talk to you guys soon. Any questions, any comments, happy to talk. Share with your friends. What is it now? Like and subscribe. I don't know, it's not a huge deal for me, but yeah, happy to share, happy to chat with people about this stuff. All right, talk later. Bye.